Okay.
Thanks, Shirley. Good morning. Thanks for joining us this morning. I'm Brian Flaherty, BIRCH Methods Core Director. And I'll first just get some logistics out of the way. As I think you may have all heard, the meeting is being recorded. And so if you want to share it or view it again later, others will be able to watch it. Shirley's going to mute us if we had a lot of people RSVP, and so it could potentially be a large group. We're going to mute, kind of keep everyone muted during the presentation, but open it up for questions and discussion at the end. If you have a question during the presentation, please put it in the chat, and I put that note in the chat also, but I'm just reminding, or I can say it here. So, and if you would like an answer or need an answer immediately, maybe just put clarifying or something just to signal to Shirley or I'm going to keep my eye on the chat. And so if that comes up, I'll try to find a convenient time to interrupt Lori during her presentation for clarification. But other questions we'll try to hold till the end. Yeah, that's all the logistics. So we're very happy to have Dr. Lori Scott-Sheldon here. She's branch chief for HIV Data Science, Developmental, Social, and Translational Research Branch, and program director of Data Science and Emerging Methodologies in HIV at NIMH. Before NIMH, she was professor of psychiatry and human behavior at the Alpert Medical School of Brown University. And you search her name in PubMed, 92 references come back, citations come back. And I noticed that several of them are meta-analyses and systematic reviews, which Lori is our next workshop. Focused, and much of her work's focused on sexual health, sexual risk-taking, alcohol, and also novel nicotine delivery systems. So I'll keep this short. Lori, thank you very much for taking the time to speak with us today. The floor is yours.
All right, wonderful. Thank you so much, Brian. So it's really nice to be here, and I really am looking forward to kind of the engaging discussion that will follow this presentation. So my talk today is really going to give you a broad overview of HIV data science, kind of the priorities, the research interests and opportunities at NIMH, as well as across NIH. But the review is not exhaustive. So by no means is this exhaustive, but I'm happy to kind of, share other opportunities with you, that are of particular interest to this group. But the opportunities that I'm going to present today really highlight some of the activities that I'm particularly interested in and involved in. So again, as Brian mentioned, if there's a clarifying question, feel free to interrupt at any time to ask those questions, but questions that require kind of a larger discussion, let's leave those to the end. All right. Oh, there we go. Okay. So just to give you a broad overview, what the Division of AIDS Research at the National Institute of Mental Health supports is that we support broadly research to reduce the incidence of HIV and to decrease the burden of living with HIV, both domestically and globally. We fund research in 3 areas: in the basic and clinical neurosciences, in the behavioral and social sciences, and in mental health, with a high priority on big data and novel data science approaches to prevent, treat, and ultimately cure HIV. But as you might imagine, the use of some novel data science approaches to address the HIV epidemic requires access to high quality, ethically sourced data. And this reflects our new NIH director, Dr. Bertagnoli's priorities for NIH to build this infrastructure to support data sharing to speed progress. So we have several broad data science priorities here in the Division of AIDS Research. I'm going to use my pointer here so that I can highlight those priorities. So these first 2 priorities here focus on extending our research investments by making data available and by identifying the common data elements that enable data integration, sharing, and reuse. Our third priority here seeks to expand our investments to support innovative, ethical, and data-driven behavioral, cognitive, neurological, and biomedical research. And finally, this fourth priority here extends our investments, again, by participating in NIH-wide data science efforts to support the development, enhancement, and expansion of tools, technology, and training available to our grantees. So these overarching goals, so these four goals that are the four priorities that I just mentioned. So the overarching goal of these priorities is to build this modern data ecosystem that can lead to new HIV discoveries. This ecosystem includes the collection, harmonization, and the storage of HIV and mental health data that will enable future analyses that can lead to new HIV insights for ending the HIV epidemic. And over the next few slides, I'm going to talk about our efforts to kind of build this modern data ecosystem within the Division of AIDS Research at NIMH. So just to give you a little bit of a history of data sharing at NIMH, data from all research that has been funded by our institute was expected to be shared via the NIMH data archive since 2018. But the HIV program was exempt from these data sharing requirements. But as I just mentioned, to really address the HIV diagnosis, treatment, and prevention and response needs, so the EHE kind of priority areas, we desperately need data. And the field of HIV has generally had a considerable lack of available data for several reasons, including some of the concerns in the early 80s and the 90s about patient privacy and safety, as well as ongoing stigma and discrimination towards people living with HIV. Now, many of these concerns, still exist today, but we have better methods for collecting, sharing, and reusing data to maintain data privacy, security, and most importantly, the trust of our research participants. So in 2022, we released a policy at NIMH that brought the HIV data into the broader NIMH data sharing requirements. So in January 2023, along with the rest of NIH, the HIV portfolio and our HIV grantees are now expected to share data in the NIMH data archives. And although we don't currently have much data focused on the HIV portfolio in the NDA at this point, we expect to see more data being shared by the end of fiscal year 2025, and that pool of data is expected to grow. Just as an aside, in addition to our data sharing kind of activities, we also are recognizing exemplary data sharers by issuing this data sharing challenge in conjunction with the National Eye Institute, which is an NIH-wide initiative that we at NIMH, specifically the Division of AIDS, is participating in to, again, come up with this index to recognize those exemplary data sharers. This is kind of similar to what you would expect for the H index or the I index. So if anybody's interested in that, please reach out to me and I'm happy to give you more information about that. But please do note that the first date registration is due by March 2025. So if you're interested in this, please, reach out to me as well as make sure that you register. Okay, so getting back to some of our data sharing activities, specifically at NIMH and in the Division of AIDS Research. So in 1998, we also established the National NeuroAIDS Tissue Consortium to collect, store, and distribute samples obtained from people living with HIV, which is now only in FY25 being extended to a data repository that will also include other clinical, neuropsychiatric, and longitudinal imaging data, again, to promote data sharing and reuse, not only in the behavioral and social sciences space, where most of our data for those grants are going in the NDA, but in our neuro HIV space as well. And so this expansion will allow us to advance research in neurocognitive, mood, and behavioral disorders associated with HIV. And one other opportunity I want to mention is our participation in NIH-wide funding opportunities for data sharing. So one example is that these administrative supplements for AI and machine learning readiness of NIH supported data. So over the last 3 years, we've participated in this NIH effort to provide funding for our investigators who want to share their data more widely and prepare their data for greater use. And so I'm going to highlight here Dr. Claude Mellons, who has the most comprehensive longitudinal data set in mental health, substance use, behavioral risks, and social determinants of health. They've followed 340 Black and Latinx adolescents that into their teen years, into their now early adulthood, who were perinatally infected with HIV and those who were perinatally HIV exposed but uninfected. They have 10 waves of data collected between 2003 and 2023. And so they were awarded a supplement to prepare their data set for data sharing in 2021. And so we are looking forward to the outcomes of this particular resource. So in addition to making data available through either the NDA, through our various efforts with the broader NIH community, there are also a lot of data that's available through other sources that are collected every day from either smartwatches, such as wearables, other sensors, public health department data, electronic medical record data, smartphones, administrative claims databases, to name a few. And a lot of this additional data comes from multiple sources, multiple modalities, types, locations, languages, and levels. And it's expected that over 150 zettabytes of data will be available by 2025, with the most profound increase in healthcare data with an expected annual growth rate of 36%. So we have quite a bit of data to integrate and to harmonize. So drawing insights from not only the NIH studies, so all the data that we've collected and funded through NIH, as well as other data sources such as these public health data sets and these wearables, requires common measures, methods, and tools for data harmonization. So this is kind of the next wheel in our building our modern data ecosystem for HIV and mental health, so the data harmonization space. So we're supporting data harmonization in several ways, including policies to collect and share common data elements specific for HIV and mental health research. So again, in 2022, we issued this new policy that required certain common data elements across all of our HIV-funded investigators. This includes age, sex at birth, current gender, HIV status, ART or PrEP use status, as well as a couple of measures of symptoms of anxiety and depression, including the PHQ 8 or 9 and the GAD-7, as well as a child-related measure. We also included recommended several measures related that would be beneficial to our grantees and our community. This includes social and structural determinants of health, and in conjunction with the National Institute of Minority Health and Health Disparities, there was an NIH-wide effort to come up with social determinants of health collections. And so there's both social and structural determinants of health here in the Phoenix Toolkit that can be used. We also, in collaboration with Fogarty, NIDA, and the NIH Stigma Scientific Interest Group, developed the Stigma and Discrimination Toolkit that includes recommended measures to assess stigma and discrimination among people living with HIV. We also have other measures that we're interested in, but again, not required, but recommended measures that would be important for our particular community of investigators. We're also supporting efforts for high priority HIV data harmonization, including the collection, integration, and harmonization of neuro-HIV data to identify biotypes of CNS complications and to identify a set of common measures that neuro-HIV investigators can use upon initial screening of participants in many of these studies, as well as the longitudinal measures necessary really to kind of characterize and understand CNS complications in people living with HIV. All right, so in addition to the data collection and harmonization efforts we're participating in, we also need to now store our data. And so we are participating in several efforts to store and share our data that we collect and harmonize, including, again, as I have already mentioned, the NIMH Data Archive, which is just one archive amongst a number of archives that are managed by NIMH. In addition, we have 6 different repositories that have been supported by the BRAIN initiative that have benefited our neuro-HIV investigators, as these enable, the data sharing of a variety of different omics data, including, microscopy data, as well as neurophysiology data and electrophysiology data. And then we also participate in this NIH-wide effort to support these generalist repositories. So it's what's known as the Generalist Repository Ecosystem Initiative, or GREY, where there are 7 different repositories that can be used if our investigators, their data is not supported in our data archive or by our BRAIN initiative. So there are other opportunities to share data. Okay. So our 4th area in our modern data ecosystem is now analysis. And so here I'm going to describe some of our priorities, give some examples of supported HIV research, and some of our current and future funding opportunities. So the overarching goal of the data science program in HIV is to use data science tools, technologies, to end the HIV epidemic, both domestically and globally. And the HIV data science agenda at the NIMH focuses on 4 main areas. The first is to promote the use, visualization, and communication of data generated from HIV behavioral and social, clinical, neurological, and biomedical research that can be easily understood by a broad range of individuals. We also seek to support scaling HIV data science efforts by generating synthetic data sets or by using a federated learning approach to more rapidly respond to the dynamic, complex, and evolving HIV epidemic. And just as an aside, when I say synthetic data sets, I mean data sets or data generated from real data, such as, electronic medical records, so that we can enable the widespread use and sharing of these data when the original or the de-identified data sets cannot be made available. I'm not talking about synthetic data for augmentation purposes. So I just want to make a point of that. The third overarching goal of this program is to advance the use of data science, methodologies, and technological approaches, such as explainable and generative and translational AI. And then finally, this program supports the development, use, and application of novel assessment tools, data sources, and digital biomarkers to improve the uptake of HIV testing, treatment, and adherence. And we support a broad range of funding opportunities in data science, and you can find our notices on our website. If you just look for our Division of AIDS Research and HIV-related funding opportunities, you'll see an entire list. Some of them are not specific to HIV, but they have not specific to data science, but they have data science components embedded into the overall funding opportunity. I'm going to highlight just a couple of funding opportunities that I think might be of interest to this group. So this particular funding opportunity, NOTMH 23350, is the program announcement. So it's a notice of special interest requesting kind of research that focuses on building an infrastructure for safe and efficient data sharing, for developing transparent AI and machine learning models, and to support translational AI and machine learning research. And there are several programmatic priorities of interest, including but not limited to the use of generative AI or large language models for HIV, federated learning systems, contemporary causal inference methods, and workforce development and training opportunities in AI and machine learning to enhance researcher diversity. I also wanted to highlight this concept clearance again that I think it will be particularly interesting for this group. And so in January of 2024, so earlier on this year, I presented the multimodal artificial intelligence opportunities and challenges for HIV clinical care concept, which was approved at our council meeting. There are no other details besides what I have here, and I'll explain this in a second, of this particular concept, but I wanted to bring this to your attention because concepts often signify potential future funding opportunities. So this specific concept was intended to support the use of multimodal AI to accelerate HIV diagnosis, prevention, and treatment, and a variety of applications to do so. It requests the use of knowledge graphs to strengthen the model interpretability and explainability, and promote the synergistic integration of these knowledge graphs into these multimodal models to, again, more precisely, to have more precise outputs and increase the usability of the HIV diagnosis, prevention, and treatment application. We expected to use that investigators would use best practices to ensure data privacy, security, and consent, and that they would include cross-disciplinary teams. So everybody who would need to be involved, from the content domain experts to the software engineers, the data scientists, the software developers, perhaps healthcare, the folks in the healthcare system who might be critically important for the implementation of such a multimodal AI model. But most importantly, this particular concept here encourages this human-centered AI approach so that we can have a more transformative, meaningful, and sustained impact on clinical care. Okay. So in addition to these funding opportunities, I wanted to talk a little bit about some of the cutting-edge work we're doing in data science. So here are a few examples and some of the different areas in which we focus, in which the research is focused. Some of these projects include developing decision tools, such as a PrEP decision tool by Julia Marcus and Doug Krakauer, in which they developed the tool and are now currently in their R01 implementing the tool into a large healthcare system to test out, the effects of that particular tool. Jessica Ridgway has work on developing a risk prediction model for retention and care and loss to follow-up. Sandy McCoy, in some of our global work, has developed an app to distribute financial incentives for people living with HIV who are at risk for loss to follow-up. In addition to these kind of decision tools and other kinds of apps, we also have those who are doing some cognitive phenotype. And I'm going to explain these in a little bit more detail in a second, as well as the investigators who are mining social media messages to be able to have a broad, more widespread distribution of an intervention. So to give you a flavor of some of the data science work we're funding at the NIMH, so I wanted to highlight 3 grants that I just mentioned on the previous slide, funded through this program, that are using different data sources, methods, and populations to kind of give you a really broad range of some of the work that we've supported. So Dr. Raha Daskeb, who's from the Johns Hopkins University, was funded by us to use machine learning to identify distinct cognitive phenotypes among people living with HIV to better understand the underlying pathophysiological mechanisms of each cognitive profile. Using data from 929 virally suppressed HIV-positive women enrolled in the WISE study, which is a multi-center longitudinal study that investigated the progression of HIV disease in women for over 20 years. 17 neurophysiological measures were used. You can see this list right here, to identify groups of women with similar cognitive profiles using self-organizing maps, followed by clustering using the R-based package MCLUST. And then factors associated with these cognitive profiles were explored using random forest models and extracting variables of importance. So in this study, Dr. Daskev found that 6 clusters representing different profiles of cognitive impairment, such as executive function, which you can see right here, if you can see my pointer, as well as global weaknesses right here, this one to the far right, as well as an unimpaired cluster that was identified. Random forest plots were used to identify the sociodemographic factors, the clinical markers, and the behavioral variables that differentiated profile membership. And what she found was that overall, women in the impaired, so that's combining all of these 5 categories together, versus women in the unimpaired profiles, had a higher minority and Southern representation, meaning that the clinics were more likely to be located in the South. They reported less education. They reported they had greater use of protease inhibitors, had a lower BMI, and a history of crack cocaine and heroin use. And these findings are critically important because cognitive phenotyping may facilitate more targeted interventions or treatment approach for cognitively impaired women living with HIV. So the next study or the research project I want to highlight is Dr. Jessica Ridgway's work from the University of Chicago, who has a K23 award to develop machine learning predictive model to identify patients at risk for dropout in an urban HIV care clinic using EHR data, geospatial data, and data from the US Census Bureau. She used data from 713 HIV positive patients enrolled in the University of Chicago Adult Health HIV Clinic from 2008 to 2015. And this research tested several different machine learning models, as you can see here, listed here. So the best performing model for retention in care, which is the panel shown on your left, and accessing care, which is the panel shown on your right, was random forest, with the mean positive predictive value of 24.5 over here and 34.6 for assessing care, for identifying the top 10% high-risk patients needing intervention. These findings show that machine learning models can improve predictive ability of HIV clinics to proactively identify patients who are at risk for falling out of HIV clinical care, and can allow for us to better allocate the limited resources to patients who may discontinue care. And then finally, last but not least, I want to highlight one additional study that's done by Dolores Albarracin, who's at the University of Pennsylvania, funding to examine the association between social media messages and other communications with PrEP use and HIV testing in geographical regions with a larger men who have sex with men community. The study combined individual level data from over 30,000 MSM who were enrolled in the American Men's Internet Survey, county level tweets when Twitter was still Twitter, from about HIV, and estimated county level men who have sex with men rates. Tweets were converted into frequency matrix of token counts using the Python package scikit-learn, and the matrix of token counts were analyzed using LDA to group words appearing together to create topics. Dr. Albarracin found that tweet rates were associated with PrEP use and HIV testing in counties with higher rates of men who have sex with men. And in the mediational analyses, she found that tweet rates were associated with PrEP use. So you can see this here in these 2 panels here. And Twitter topics were associated with PrEP use. And that hearing about PrEP was associated with use, which was associated with HIV tweet rates. So again, this path here. These findings can be used for designing effective large-scale digital health campaigns to facilitate communications about HIV and promote HIV prevention behaviors. So while these are illustrative examples of some of the many activities in which we're supporting in the Division of AIDS research to kind of build this broad, modern data ecosystem for HIV and mental health research, data science research in HIV has grown rapidly over the past 2 decades with an annual rate of growth of 23%. And many of the rapid technology development, as well as a commitment by the NIH to fund data science research beginning in about 2013 with the Big Data to Knowledge initiative, likely contributed to some of this acceleration in the use of data science approaches to address HIV-related research questions, with 17% in publications of an increase in publications since 2017. So this red kind of dashed box here. Some of the newer programs supported by the Office of the Director, such as the DSI Africa program right here, as well as the Aim Ahead and the Bridge to AI program, continue to influence kind of the growth of data science and HIV. And some of these newer programs address emerging scientific opportunities, priorities, and innovations in data science, including novel methods to assess the social determinants of health and reduce health inequities, which are areas of critical importance to the NIMH Division of AIDS research. And the use of these novel methods, tools, and technologies will likely become increasingly important as we continue to expand our modern data ecosystem to support HIV and mental health research that can move us closer towards ending the HIV epidemic. So Brian, can you tell me how we're doing on time?
We're fine. It's
Okay,
10:35.
Okay, great. Thank you. All right, so I wasn't sure if I was going to be able to cover this, so I'm happy to hear that I am. So I'm going to pivot a little bit right here and talk a little bit about the data science activities across NIH. This is related to our 4th priority that I presented in that 3rd slide, to expand our investments so that we can expand kind of the opportunities for our grantees. Again, I'm only going to highlight a few of the programs and initiatives that I'm directly involved in and that I have particular interest in, but there are a lot of different opportunities or other opportunities that I'm happy to talk about if you are interested. Okay, so I'm going to first talk about 3 different programs that are supported by the Office of the Director, 2 from the Common Fund. So this one, which is the Data Science for Health Discovery and Innovation in Africa, or the DSI Africa program, is a Common Fund program that leverages data science technologies to transform biomedical and behavioral research and develop solutions that would lead to improved health for individuals and populations. The DSI Africa Consortium includes 38 different projects, as you can see here, kind of written here on the side, including 20 research hubs or research projects, 7 training projects, 4 ethical, legal, and social implication projects, research projects, 6 education projects, and 1 open data science platform and coordinating center. The consortium has about 350 very actively involved members. And I want to spotlight a couple of the projects that I'm most interested in, primarily because I serve as the project scientist on each of these projects. So the first project I'm going to highlight is the UZIMA project, which is the Utilizing Health Information for Meaningful Impact in East Africa Through Data Science. This project focuses on maternal, newborn, and child mental health, and has a lot of unique aspects to it, including administrative supplement to support the generation of synthetic data. Again, kind of coming back to that kind of idea where we want to support synthetic data efforts for data that can't readily be shared with the broader community for privacy and safety concerns, such as clinical data. And so the UZIMA project, in addition to focusing, on their critical research questions associated with maternal and child health, are also engaging in quite a few advancements in data science to support data science research within Africa and the sharing of data. The second project that I want to highlight is one of the training projects. So this is the DSSD, which is the NYU Moy Data Science for Social Determinants training program. And this is led by Rumi Chunera, who's at NYU, and it's done in conjunction with Moy University in Kenya. And in this program, they are training early career investigators on how to incorporate and measure social determinants of health and bring those into their larger data science efforts. So the next program, again, funded by the Office of the Director that I want to highlight is the Aim Ahead program, which was developed to address the lack of diversity in research by strengthening the participation and the representation of researchers and communities currently underrepresented in the development of AI and machine learning models focused exclusively on clinical care. This program spent 2 years really planning, assessing, and capacity building to really come up with equitable AI and machine learning training and infrastructure. And so we continue to see great work coming from this particular program and looking forward to the additional training that our investigators will receive. All right, so the last Common Fund program or program supported by the Office of the Director is the Bridge to AI program, so the Bridge to Artificial Intelligence program. This, again, is a Common Fund program with the intention to generate flagship data sets, prepare AI-ready data, build ethical AI, and promote diverse teams across 4 grand challenges in clinical care, functional genomics, salutogenesis, and precision public health. I'm specifically, or particularly involved in the training, recruitment, and mentorship core of this Bridge to AI Center to support a diverse range of trainees from clinicians to early stage investigators. So the training spans everything from, basic understanding of AI and machine learning and how it might be implemented into clinical workflows, all the way to the actual development of and the coding for AI and machine learning. Again, with this broad focus on kind of clinical care, improving clinical care and public health. Okay, so in addition to the Office of Director supported programs, the Office of Data Science strategy also has released, this overarching data science priorities and has several efforts and are supporting several efforts in which we are also participating in to provide opportunities across a wide range of activities. And even though I could speak to all of these different, kind of pillars here as part of the data science priorities, I want to focus our attention today on the data management and tools and analytics, as we've been actively engaged in providing, or trying to find opportunities for our grantees in software tools and AI. So one example, we recently released this funding opportunity to advance health research through ethical multimodal AI in the biomedical, behavioral, and clinical fields. This particular program is expected to support up to 10 projects with an annual budget of $1 to $2 million per project, with an estimated expected budget of $20 million over a 2-year period. And I just want to highlight one of these projects because we've only made one award to date. We expect the other awards to be made sometime during the first quarter of fiscal year 25. But we were able to make this initial award a couple of weeks ago. And this award is entitled Unifying and Fair Multimodal Representation Learning for Autoimmune Diseases. And the purpose of this particular project was to use a data-driven approach for equitable, early, and efficient diagnosis of lupus and other autoimmune diseases through multimodal analysis. Again, I serve as the project scientist on this other transaction authority led by Mark Niederheimer, who's a professor of computer science at UNC Chapel Hill. And we're really looking forward to kind of what comes from this particular project. And hopefully the next time I come and see you all, we'll have more information about I'll be able to share more information about some of the other projects that will be funded. And last but not least, I want to kind of bring up our NIH-wide initiatives for enhancing software tools for open science. So I am part of the NIH Office of Data Science Software Working Group. In fact, I chair this working group, which is a NIH-wide working group to provide, to support our research software engineers and to support the software development for research. And over the last 4 years, we have issued 4 administrative supplements to support the enhancement of software tools for open science, as you can see here. And we have awarded 124 supplements to date across 21 ICs and with an investment of about $30 million to date. And one of these supplements went to our own Michelle Burkett, who is an HIV investigator from Northwestern University. And in this particular supplement, she was developing a remote survey administrative capabilities to support HIV and STI partner services for contract tracing purposes that can ultimately be used to support real-time public health efforts on disease transmission networks to reduce HIV, STIs, and COVID-19 outbreaks. So that's just one example of the 124 software supplements that we've funded today. And if you're interested in these supplements, all of them are currently listed on the ODSS website, as well as a brief description of all of them. But in addition to these 4 administrative supplements that we have published over the last 4 years, we have now, just recently, just in July, published or issued 2 RFAs to continue our efforts here to support sustainable research software among our investigators across NIH. And this first one is maybe something that's probably pretty unique and something that you're probably not aware of, this particular mechanism, this R50. And so this funding opportunity supports research software engineers who bring, their unique skills to build sustainable open software tools. And we want to foster their development to continue this kind of work, who may not, typically have a traditional path in the scientific kind of in the NIH funding kind of opportunities. And so we wanted to give them a specific, a path to be able to develop their skills and to continue to support NIH research. And so the first due date is December 4th of this year. And if anyone's interested, I'm happy to answer additional questions about that. And the second RFA that we just issued again in July is this R03. So this R03 is again to build sustainable software tools for open science, not directed towards a specific individual, but more broadly to support the continued development of these tools that really provide value for our research. These are 2 years awards with a maximum of $300,000 budget over that 2-year period, and we expect to award about 20 to 25 awards per year. This has the same receipt date as the R50, and so these will be due again in December 4 of this year, December 4th. So if you're interested in either of those opportunities, please reach out. Happy to provide additional information and connect you to the right institute or center who might be interested in your particular project. All right, so before I leave today, or before I end this talk, I just want to kind of bring us back here to some of the investments we've made in data science. So the NIH data science budget has steadily increased since the spending category has been tracked from $662 million to in 2019. So that was the first year we've been tracking this information to an estimated $1.6 billion in FY 2025. Our investments in data science are expected to continue to grow. especially given the widespread availability of data and the rapid advances in technology we've witnessed over the last several years. Especially during this same period here, where I noted the rapid rise of HIV investments in data science in the last 7 years. And we're poised to have and these rapid advancements in technology and as well as our investments are really poised to have a an influential and substantive impact on HIV over the coming years. And so we look forward to additional projects that are focused in the data science space, and happy to kind of help guide you with your future research endeavors. So that being said, I want to thank you for your time and attention. And we are always happy to hear from you. So please reach out if you have any questions or ideas or want more information about a funding opportunity. You can connect with me. I've provided a number of ways in which you can do so. You can join our NIMH DAR listserv. You can join the NIH Office of Data Science Strategy newsletter to get all of the information about all of the latest happenings across NIH, as well as funding opportunities, and as well as connecting with us at the NIMH across a number of different social media platforms or our YouTube, including our YouTube channel. So again, thank you so much for your time and attention, and I welcome your questions.
Thank you very much, Lori. Again, we have a few minutes, about 10 minutes left.
Okay, great.
And so, yeah, please. Shirley, I think you had said maybe you would unmute or allow the unmuting of people now instead of restricting it. And so if you want to do that, if anyone has any questions, please.
Yeah, definitely. Feel free to unmute. You should be able to do so, or put your questions in the chat.
I know I threw a lot of information at you in a very short period of time, trying to capture everything from our NIMH activities, as well as some of the, what I would say, highlights of NIH related activities. Maybe this was too much at once, but happy to answer any questions.
Happy to let people think. I have some questions, but they're kind of specific to my own, and so I feel like it's more appropriate for me to email you. But
yeah, and happy to do that too. I actually make it fairly easy for people to connect with me. So if you go to one of the websites, you'll see a link to my calendar, and you can just put a meeting on there and just tell me why you'd like to meet, and I'm happy to do that. Okay. Oh yes, Albert. I'm happy to talk a little bit more about the R50 and R03 opportunities. Yeah, so this is going to be a little different. It's a little different than the what we've been doing with the administrative supplements, where those have been reviewed internally. This time it's going to be handled by CSR. And so they'll convene a special emphasis panel to review all of these applications. And so we hope that the panel will include both people with technical related experience as well as those with content related experience, so that they understand that whatever the software is that's being developed, it's appropriate for that particular area. And so the R50 provides salary support, which is very unusual for research software engineers. It provides 6 months of salary support. You are expected to continue to engage in NIH-related software development activities with a PI or more than one. You might be involved in more than one project, but at least one project. But then you have an opportunity to continue to develop your own skills. So that's kind of it's a really unique program, and something that we're really thankful that the Council of Councils approved for us to be able to do. And the R03 is very similar to a traditional R03, except that we've allowed for a larger pot of money. So instead of what's typically offered, right, it's $300,000 across 2 years, which was, quite a substantial increase from the traditional R03. And so that gives people a little bit more of an opportunity to really kind of build out whatever software that they're interested in building.
To follow on about that RO3, is that to fund kind of already in existence community or group supported open science software projects, or could it be to fund software that is sitting on a PI's computer that has been written but isn't really made for prime time yet for broad distribution?
Yeah, it actually could be both.
Okay,
right?
thank you.
Yeah.
Thank you.
Hi, Lori.
Yes.
Could I
Hi.
ask? Hello. So for that, like, what's the end goal for those applications? Is it make it open software?
That's exactly right. So we really want to support open source software, right? And sustainable software projects. And we think that one way that can be done, I mean, and there are many ways, is to make it broadly available to the community so they can continue to contribute to the software.
So I guess follow-up question is that a lot of times those software needs to be maintained. Like what happens to, that part of the site?
Yeah, that is a really important question. And we're hoping that, some of the investigators that come in kind of come up with some really creative ideas to support the maintenance and sustainability of those projects that go beyond, NIH funding.
Thank you very much.
You're welcome. And yes, Nancy, I'm happy to share the slides later so that you can get access to those QR codes.
Any other questions for Lori?
Hi, Lori. Thank you so much for your presentation. I wanted to ask about funding opportunities for early career investigators to see if there was any more information about that.
Yeah, we have lots of different funding opportunities. I'm not sure exactly which level. When you say early stage, early career investigators, are you meaning assistant professor level? Or are you meaning, more postdoc?
More postdoc or graduate student level?
Yeah, so we do have a number of funding opportunities, and I'm happy to put you in direct contact with our training director who can speak, much more eloquently about the various opportunities. But we have a number of different opportunities, some that are specific in data science and some that are more HIV related, not necessarily focused on one particular area as long as it's HIV, right? And so it can be a broad array of HIV related activities. And so I'm happy to, put you in contact with, if you want to pop your email address in the chat, I'll copy that and we'll send it to our training director who can kind of go over all the various opportunities for postdocs.
That sounds great.
Yeah.
Thank you so much for that help with that.
Yeah, no problem. Oh, yes. I'm getting some really good questions here. Okay, so yeah, some research that's focused on ethical AI. So some of these projects could, so maybe I should repeat the question for clarity for people who are listening to the recording and not, and can't see the chat. So Nancy is asking, can you share some examples of the focus of research related to ethical AI applications? So there are a number of ways this could be addressed, whether it's, you're looking at the data itself, how the data was sourced, is the data ethical? Does it represent, the community that you're interested in? Or are there some gaps there? Maybe there's some missing data, or maybe the data is skewed because maybe they were only pulling the data from one kind of type of clinic. And so really kind of understanding the data, that could be the first place, as well as kind of when you're developing models, testing whether and mitigating any potential biases in those models so that we can develop a more ethical framework for to address HIV. And so there are a number of different ways to do this, and these methods are still evolving. So I don't want to say that there's one way to go about identifying and mitigating problems in in algorithms or other predictive models. But if you get connected, there's a group, just trying to remember the name. Oh, I can't remember the name right now off the top of my head. It'll come to me, I'm sure, in a second. But there's a group that's very actively involved in kind of developing methods for addressing biases and to identify and mitigate these biases in models. And as soon as I remember, I will let you know. But yes, so there's a number of different ways, and I encourage you to think kind of outside the box too. If there are creative ways in which you can address some of the biases or some of the other problems inherent in either data or in the algorithm development or the deployment, right? Or the implementation of some of these algorithms, perhaps in clinical care or a community setting. I really welcome those creative ideas.
Well, thank you again, Lori.
Absolutely, yeah. Happy to talk, about more funding opportunities, or if there's a funding opportunity that you're interested in to figure out whether or not, you're the right candidate, or whether your idea really fits within the scope of the program, of the opportunity. Yeah, happy to do that.
Great.
Yeah.
Great, thank you.
You're welcome.
And thank you for saying so, because people earlier in their careers are maybe less sure about when it's
Yeah.
appropriate to contact and when it's not, and what is appropriate and what's not. So thank you for saying so.
No, we welcome everyone, right? And so this is part of our job, right? Is to actually be here, be a resource for the community. So yes, please take advantage of us. That's why we're here. That's why I make my calendar available to the broader community so that you can see when I'm available. You can make an appointment at the time that's convenient for you so that we can talk either about, maybe you just want to talk about, broadly about what are the opportunities available to me, or, maybe more specifically about, I have this idea. I think this is the right notice of funding opportunity. Can you provide some guidance? And so happy to do so either way, or anything you'd like to talk about.
Thank you. That's broad. Anything is broad.
Well, within
Right,
reason.
of course. Thank you again. A
Yeah,
round of applause
absolutely.
doesn't really work on Zoom like it does in a room, but thank you. Thank you again.
Yeah, thank you so
Yeah.
much. Have a nice weekend, everyone.
Thank you.
Take care.